What is up, everybody? Welcome back to Medicine with AUNO. Today we are going to have lecture 7 on referred back pain. This is our last lecture in the series of the patient with back pain. So let's get started. Before we get started, who knows what's in this picture right here? This is something we will discuss. So, non-orthopedic causes of back pain. So we talked about everything else. Wait. Yeah, we did. Okay, so we've done all this now. So we are now going to talk about pancreatitis, pyelonephritis, aortic aneurysms. So there's many causes of referred back pain, but a few conditions that can cause this are pancreatitis, pyelonephritis, and AAA. Isn't there something called like the AAA Association? Anyways. Acute pancreatitis down here. This is where the pancreas, the digestive and endocrine organ, is inflamed. And pyelonephritis is where the kidney, an organ of the urinary system, is infected. In fact, I think I might have had pyelonephritis in February when I had a kidney stone get stuck in my ureter. That was not fun. And then abdominal aortic aneurysm. This is where the largest blood vessel in the body is dilated, and we can see that down here. All right, so these are CT scans. This is pretty cool, and this will show why these things can cause back pain. So acute pancreatitis, I'm not really sure exactly why, but it is located, close to the back side here. This is the vertebral body. So this is the front up top, and this is the back of the patient. These are the kidneys here, the liver right here, and the spleen, and some bowel, and the pancreas right here, and some peripancreatic fat stranding seen right here. Inflammation, and the pancreas is inflamed. So that can cause back pain. Now this makes a lot more sense. Look at this one. Right pyelonephritis. Right kidney has pyelonephritis. And look at this. It's really abutting the vertebral body. So that's definitely going to cause some back pain. And then, lastly, the abdominal aortic aneurysm. This one is massive, y'all. And this is also compressing or abutting, or it's just right next to the vertebrae, right? All right, we're going to move here. Oh. So that's just to show, you want to know the reason these cause back pain. Well, they're so close to the back. And when these things get real inflamed, they can even, I guess, hit that vertebrae. Okay, so brief overview of symptoms, because we want to know, I'm not going in depth on these because we probably will make videos on these. But we just want to know how to differentiate these briefly in someone with back pain, because usually you can tell, right? Pancreatitis, you're going to have back pain, acute and persistent. Our other causes of back pain might be acute, but this is going to have epigastric pain. So it's going to include abdominal pain in the front, and it's going to radiate to the back. And it's going to be relieved when sitting forward, worse when laying down. Alcohol and fatty meals worsen the pain. And you might have fever, nausea, vomiting. So, this is going to be easy. You run some lab tests, lipase, amylase, digestive enzymes, and you can usually figure that out. Here's your pancreas, right? Inflamed. Usually a gallstone's blocking the common bile duct and pancreatic ducts. Here's pancreatic duct, common bile duct, and there's blockage. Pyelonephritis, this is an acute infection, usually gradual onset of progressive unilateral flank, lower abdominal, and back pain. So, it's going to be flank pain, not just back pain. It's going to be unilateral. It's going to be, associated symptoms will include fever. Usually it's quite high fever, 101 or so, it's up there. Chills, dysuria, painful urination, foul, possible bloody urine, hematuria, and nausea, vomiting. And again, you might not see all these things. Always something I've learned is that the textbook case, of a disease, usually these diseases have variations. So it might not fit the textbook exactly. So you have to look at all this clinical symptoms and put this story together to try to say what is the most likely diagnosis, and how can we use labs and imaging to narrow this down and come up with a correct diagnosis and treatment plan. Elderly may have some cognitive issues, right? They might have just neurological symptoms. if they have this infection. So abdominal aortic aneurysms. So many times no symptoms until they rupture. Then it's like severe pain or instant death. Not a good thing. Just ripping pain, depending on if it's in the thoracic or abdominal aorta. Sometimes though these patients will have back pain preceding rupture for a few weeks, depending on how big the aneurysm is. You know, they might have some abdominal pain or a pulsation in their abdomen that a physician can feel, or the patient. And rupture usually results in severe abdominal or chest pain. And there may be bowel or bladder dysfunction as well if this aneurysm is pushing in that area. Bloating, urinary retention, pain that might go to the shoulder, or, you know, voice issues or swallowing issues if the aneurysm's up there. So this is important too, some risk factors. Pancreatitis, males with chronic alcohol use, trauma, females with history of biliary disease, or also certain medicines can lead to pancreatitis. Both, you know, it doesn't matter. Just if you use some medicines, I don't know which medicines, but when we get to that section, we'll have to go into that. But some medications are a risk for pancreatitis. Pyelonephritis, prior urinary tract infection, kidney disease, stone obstruction, sexual activity, pregnancy, or some anatomical variants, different congenital anatomy that's off can put yourself, you might get this risk for it. And abdominal aortic aneurysm, this is a male, older age. Again, it's not just male, right? It's females too, younger people too. But the highest risk, the most prevalence, you'll see this in males who are older age, with a smoking history or alcohol use, hypertension, atherosclerosis, trauma, or syphilis. But again, anyone can get these things, right? So don't rule it out just based off of risk factors. And lastly, thank you all for learning with me. We are trying to go from elementary concepts to extraordinary medical knowledge, one heartbeat at a time. So anyways,